For anybody to suggest that there's not a plan, in fact, when you look at the title of today's hearing, urgent need for a plan, that's not the title of a hearing, that's a political narrative, and a false political narrative at that. You wouldn't even be here today if there wasn't a plan, because you are the people tasked with carrying out the plan. In fact, if you were sidelined, you wouldn't be here either. And I know some people want to suggest that, but maybe they haven't spent time reading different components of the plan. These are just a few, by the way, a few of the documents that your agencies have published to show states how to safely reopen, to show schools how to safely reopen, to show nursing homes how to care for their patients, which, by the way, if all governors would have followed those guidelines, thousands more seniors in nursing homes would be alive today if just 5 governors would have followed your plan that was developed by President Trump and is being carried out by you and your teams effectively every day. So again, let me thank you on behalf of the millions of American people who are alive today that wouldn't be alive if you weren't carrying out President Trump's effective plan to keep Americans safe as we learn about this virus, as we work to get a cure for this virus. And by the way, the cure, Operation Warp Speed, is part of President Trump's national plan. And I think we've all seen just how close we are to a vaccine, which is revolutionary in modern time. To be this close to a vaccine, we wouldn't be here that close to a vaccine without President Trump's leadership and without the work of you and your teams to carry out that plan. So again, I appreciate the work that you continue to do. Every day we learn more about a plan, like any plan, whether it's a military plan or a football plan. You start the first play with a plan, and then the plan has to change as things change along the way, and we're seeing that play out daily. When you look at the work that's been done, I think we talk about different parts of the guidance. We've not always been in agreement on each part of them, but we've had a number of hearings where we've talked through how to improve testing. In fact, one of the first hearings we had in this committee on testing was back when America was maybe conducting less than 200,000 tests a day. Today, because of the work that y'all have been doing and because of the president's plan, we're at over 800,000 tests per day, and that number continues to grow. Nobody's stopping, nobody's resting on their laurels, but when you look at that trajectory, again, going from a virus that no one even knew about just 6 months ago, China lied about, during that period where we could have learned a lot more, where we could have saved more lives while China was lying. I wish we would have hearings on that, because that is a real fact. That's not a political talking point. We all know not only did China lie, they corrupted the World Health Organization, and they were perpetuating that as well. It made it harder for us. I remember being in a meeting at the White House with Dr. Fauci months ago, before it was a global pandemic, and we were talking about the desire to get some of our medical experts into China to find out what was really going on, and they wouldn't let you in. The Chinese Communist Party wouldn't let you in when President Trump wanted to send medical experts into China before it spread into the United States, and that caused lives. Why aren't we having a hearing about that? Clearly.